Welcome to Distrust and Disparities, Dismantling Black Health Disparities podcast. We examine health disparities that disproportionately affect Black women and Black families. In addition, we amplify organizations and individuals working to dismantle racist health practices and systems to improve health outcomes for marginalized communities. I'm your host, Jasmine Moore, a registered nurse, and I'm joined by my good friend and co-host, Camille White. People act like since we did it in slavery, we can do it again, and we still don't have to get paid. But it should be about being happy about your job, being proud that you can take care of someone's loved one.
In this episode, we discuss a research study that examines the lasting impact of structural racism on Black women healthcare workers in the U.S., including low wages and hazardous working conditions. And we highlight the Center for Advancing Racial Equity and Job Quality in Long-Term Care, a national hub centering Black, Indigenous, and people of color women and immigrant caregivers to build an equitable caregiving infrastructure in the U.S.
Welcome back to another episode of Distrust and Disparities. Thanks again for tuning in. In last week's episode, we discussed the Black Angels and their amazing contributions to the field of nursing and healthcare. May is like the first week in May, we celebrate nurses for Nurses Week. And just want to kind of piggyback off that theme based off some research that I found. Those Black nurses were specifically recruited to work in some of the most dangerous conditions and with the sickest patients. They were working with patients that had tuberculosis. And this story took place between the 1930s to 1960s. It's an amazing story. Like we said, check out episode 57 if you haven't already. But just fast forward to now, it's unfortunate that I have to say this, things have not changed much at all. The pandemic revealed the deep cracks in the U.S. healthcare system. Patient outcomes plummeted, even life expectancy dipped in the U.S., and it hasn't gone up compared to other countries at the same economic level. Additionally, healthcare workers worked through the unknown and fought to help sick patients, even putting their own lives at risk. And you would think we would pause after such unprecedented times and, look at what the pandemic showed us wasn't working and make the system better to improve things for patients and also for those working in healthcare as well. When you think, Camille?
You would think that it would be like, ooh, there are significant issues in our systems. Let's properly identify these, then address these to make sure that, everyone all around is going to benefit. Like you said, patients and healthcare workers, because, there will always be patients. Therefore, there will always be a need for healthcare workers. So you need to make sure the system that, everyone is functioning in, actually functions optimally. But, this is the U.S. We don't do that here because we got issues and problems galore, and we prioritize profits over people consistently.
Yes. You hit the nail on the head. It was, nope, we're going to ignore the cracks, the things that we saw. Nope, we're going to call you guys heroes and give you some hero t-shirts and, get back to work. The CEOs and all them that got to work from home safely, remotely from their family, they get to trickle back into the system and, tell us what to do and don't want to address like the system was basically crumbling and when it was like strained and you don't want to listen to us about what was wrong. It's like, no, we're in a rush to get back to this quote unquote normal. And like you said, normal is not the most efficient. It's not the most, what did I say? I was about to say the most best, or normal is shit.
It is.
We could be doing it so much better. We could be learning from what we saw wasn't working. We could be improving ratios, but we're not. And I could go on and on about that, but let's jump into this week's main story and kind of unpack what I mean. You know, things have not changed much, especially for Black women in healthcare. We want to discuss an article titled Structural Racism and Black Women's Employment in the U.S. Healthcare Sector. This article was published in February 2022 in the Journal of Health Affairs. It was co-authored by Janet Dill, an associate professor in the Division of Health Policy and Management at the University of Minnesota, and Mignon Duffy, an associate professor of psychology at the University of Massachusetts, Lowell. As always, we'll put the link to this study as well as other articles that we mentioned in this episode in our show notes. So make sure you check those out. This study focuses on aspects of racism in healthcare that is often not really paid attention, or it receives less attention. So they were looking at the role of racism in the stratification of the healthcare forces, and stratification just means the division into classes. And this study, it was specifically looking at the racialized division of care, and it examined the unique role of Black women in healthcare. They argue that structural racism in the labor market is linked to historical legacies of slavery and domestic service, and that history has had a strong impact on shaping the healthcare workforce and landscape that we see now. They point out that the concentration of Black women, Indigenous, and people of color in low-wage healthcare jobs is due to structural racism. They blatantly draw this connection, and they give the definition of structural racism, and I want to read it to you guys. Structural racism is defined as structuring opportunity and assigning value based on race, unfairly disadvantaging some individuals and communities and advantaging others. In this article, they take time to dissect the historical processes as it relates to the current patterns that we're seeing. So in this episode, we're going to dive into some of the statistics, and then we're also going to look at some of those historical patterns and kind of bring all those together.
Have you checked out our website? There you can find all of our episodes and show notes. You can even listen directly on the site and catch up on any previous episode you may have missed. You can read our bios and see what we're up to. Also, we made it even easier to contact us. Just fill out the form on our homepage and click submit. We invite you to recommend guests and topics we should feature. So what are you waiting for? Go check us out at distrustanddisparities.com.
To conduct the study, the researchers used data from the 2019 American Community Survey, and this is an annual national survey conducted by the U.S. Census Bureau to analyze the probability of Black women's employment in different occupations and sectors in the healthcare industry. What they found was Black women make up 6.9% of the labor force in the U.S. and 13.7% of the healthcare workforce. This 13.7% is an overrepresentation. So it's basically double. Black women are overrepresented in the healthcare field. And to dig even deeper, Black women are heavily concentrated in long-term care, making up 23% of the long-term care workforce, compared with 12.1% of hospitals and 9.6% of ambulatory care workers. And let's look at the comparison. So, white women, they're also overrepresented in the healthcare sector, but only at a rate of about 1.6 of their representation in the labor workforce. So, and then additionally, white women are more evenly distributed amongst different settings within the healthcare sector. So they make up about 40.8% of long term care workers, 47.2% of hospital workers, and 48.6% of workers in ambulatory care settings. So you could kind of see that kind of balance it out. They're kind of equally spread out amongst different sectors in healthcare field versus Black women who are highly concentrated in the long-term care setting. And this overrepresentation of Black women translates into healthcare being a key employer for Black women. Approximately more than 1 in 5 Black women in the labor force, which is about 22.4%, are employed in the healthcare sector. Of this percentage, 64.7% are in the licensed practical nurse or aide occupations, and 40% of those work in long-term care. And I just want to point out the category of aides includes nursing assistants in hospitals and long-term care settings, as well as home health aides and personal care attendants who work in private homes. So they kind of group all those together. But 64.7% are in the licensed practical nurse or aide occupations. This boils down to Black women being overrepresented in healthcare and more concentrated in the lowest wage direct care positions than any other racial or ethnic group, and even amongst men. Like we said, Black women, they're highly concentrated in these direct care positions, working as LPNs or licensed aides or other patient care attendants. But on the flip side, Black women are represented at significantly lower levels among community or behavioral health workers at 11.8%. Registered nurses, they make up about 10.2%. Technicians, 9.4%. And therapists, only 8.1%. In comparison, white women are most heavily concentrated amongst registered nurses at about 61%. Therapists, they make up 56%. And white women are slightly underrepresented amongst licensed practical nurses and aides, making up only 39.8%. That's a really stark contrast in the healthcare industry and like the fields that Black women are working. And then when you go even in different sectors outside of nursing with Black women, the research article also found that based off the statistics and the patterns that we see in, the probability of Black women to work as physicians is only 1%. Advanced practitioners is about 2%. And the probability of Black women becoming technicians or also community or behavioral health workers is only in the 2% range. So Black women are more than likely to become LPNs or aides in the US healthcare sector. And this was really surprising to me. And I don't know if it's because I worked majority in predominantly Black or urban areas. So I saw like a lot of Black nurses, a lot of Black nurse practitioners, and people going to school. Yes, I also saw like a lot of the aides and techs would also be Black. So I just assumed it was like level throughout the board. I didn't think it was such a stark contrast with only about 11% of registered nurses like RNs being Black compared to 60% of white nurses. I didn't think it was such a big like discrepancy or just a big gap, or just that the majority of nurses are LPNs or that they're aides. I think, for me, this was like a shocker. I didn't think it was such a difference. What about for you, Camille?
It's somewhat of a shock, but then I feel like I've been inside like assistant living facilities for seniors and been in one area where literally every single person in that facility was white, and then been in another one where predominantly they were Black, but then you did have some white people. And I would say in the one that was predominantly only white seniors, the only time I saw Black people were like the LPNs. They were the aides. That was the only time. And I could immediately be like, oh, they're in scrubs. They're working. I was one of like the few people there visiting someone that was Black. And then I think one other time I saw like a Black woman that actually resided there, and she did not end up living there very long. But it was that for me makes this even more so like this data is like, okay, it sort of in a way goes along with the thinking that I was like, why is it that they're just the LPNs, the aides? Like, I don't see them in other positions, in higher positions, like, because they're functioning like in these like so-called like direct care or jobs. And a lot of times I'm like, those are the backbone jobs of helping a lot of these different places function. And then you see in higher up positions, it's a lot of white faces, the ones that are the supervisors, the ones that are managing stuff. And I always found that to be a little bit interesting. Yeah. And also having, a knowledge of like, that's because of structural racism, or even too, I think it makes me think about all of like a lot of immigrants, a lot of African immigrants that are Black women that end up in these roles. And I think, again, that's like due to structural racism, where they all have the capabilities of being like leaders and supervisors and stuff. But it makes me feel like we're being relegated to these nurturing, almost mammy-like roles of like, you're giving this direct care to a patient and you're not being seen as like higher up to sort of be the leaders of managing whoever happens to be in those positions. I feel like it's heavily a lot of Black women that I've been able to see in those roles.
Yeah, I'm glad you brought in your perspective, because, yeah, it makes sense. Like when you go to these long-term care facilities, you mostly see like the aides and things like that. And even in the hospital, I think certain units, certain types of units, you'll see like a lot of like Black nurses in, but maybe like outside the city, you don't. But if you look at roles like housekeeping, secretaries, and food service and prep and things like that, you will see a lot of Black people and people of color. And like you said, you brought up the structure, and we'll dive into that. The article, they point out that although the healthcare industry includes a wide range of jobs, the parts of the sector in which Black women are concentrated in are characterized by low wages, lack of benefits, and hazardous work conditions. And we'll discuss the pay first. While Black women do some of the hardest work in healthcare, their paychecks don't reflect it. The mean hourly wage in 2019 for home care workers was $12.12. Residential care workers earned an average wage of $12.69 per hour, and nursing assistants in nursing homes earned about $13.90 per hour. These low wages translate into low incomes, and low incomes lead to high poverty among long-term care workers, and approximately 1 in 6 home care workers live below the federal poverty line, and nearly half live in low-income households. Among Black and Hispanic female direct care workers specifically, about 50% earn less than $15 per hour. They're doing the hardest work and they're being paid the least, and they have so many demands put on them. And I just want to pull out this quote from Tracy Mills Jones, a 57-year-old long-term care worker in Palmdale, California. She earns about $16 an hour through the state's in-home support services program, taking care of 2 clients. And she points out, I'm changing all the sheets, I'm changing diapers, I'm doing all the work as an in-home care provider, and they're only paying us dirt cheap. Sometimes her low pay means, quote, I have to pick whether I'm going to eat or pay a bill.
$16 an hour is very low. And I think people need to understand too that like we've been fighting years ago to get to $15 an hour for just minimum wage for, say, you know, fast food employees, retail workers, and people would scoff at that because they'd just be like, oh, that's too much money, when it's like capitalism has rotted your brain and made you think that like certain types of work deserve to be paid more and others you get to exist on pennies and you can figure it out. Because I don't get why just because someone works at fast food and retail doesn't mean they shouldn't be able to pay all their bills while also feeding themselves, while then also taking care of any dependents, taking care of any pets, and then having money left over to say, I don't know, enjoy life a little. It's the mindset that people think that already that was too much for a certain group of people. But then you look at these individuals who are doing very difficult roles, like taking care of a whole other human being that is a whole grown adult dealing with whatever they got going on. Probably you got to manage medications, don't know in terms of what their mobility is like. So you're helping them in and out of possibly wheelchairs or with walking aids. There's so many other things of like Tracy talking about changing sheets. So, you know, bowel movements and things like, so the fact that they would be paid so little and such a like significant role is very eye opening, because I feel like you see it as just like, oh, well, it's just low wage work. It's just, that's just a woman's job to, you know, take care of someone in their home. And so you pay them pennies and go, we'll figure it out. And it's just, it's very upsetting, because it's just like, again, without these people, how would our society function? What would happen? We wouldn't function.
Exactly. And working long, hard hours, taking care of people who, you know, cannot take care of themselves, that need help with every single aspect of their lives. And like you said, people are like, oh, paying them X amount of money is a lot. But you're looking at it, you're comparing it to yourself. You're thinking only about yourself, like, oh, if they're getting this, but I'm only making this. But we need to look at the system. Like, wages overall have not gone up in comparison to the cost of living, the cost of college. It's like wages have stayed stagnant for decades. And it's like the whole system, we all need to be paid more for what we're doing. We're doing a lot. And if you look at like how much we're being paid, we're not being paid what we should be. Like, compared to the cost of college has gone significantly up, but the money for like entry level jobs and just even like regular jobs has not gone up, but the cost of everything else, the cost of food, the cost to buy a house, the cost to even like rent, like all these things are eating up at our paycheck. And we shouldn't be mad. We shouldn't be, and they want us to like fight each other like, oh no, they don't deserve this and that. It's like, no, we all deserve a raise. We all deserve to make a fair living, to, be able to enjoy our lives. It shouldn't just be we're working and have to decide whether we're going to feed ourselves or if we're going to pay a bill. We need to be looking at these huge corporations that are raking in millions of dollars and then just paying people the bare minimum. Because if you're a major company and most of your the people that work for you are living below the poverty line, I think that's insane. And let's get into some of the difficult and dangerous working conditions that these workers, these direct care workers, have to face. Overall, healthcare workers have the highest rates of workplace-related injuries of any industry in the United States. And then within that workforce, nurses' aides and nurses are much more likely to experience workplace-related injuries and stress compared to other healthcare workers. In addition to being exposed to biological agents such as viruses, direct care workers are exposed to heavy lifting of equipment and patients, physical and verbal assault, and a range of high stress conditions, including long hours and night shift work. And Black women are more likely to work in those nursing homes and other long-term care settings that are the most understaffed and under-resourced, leading to greater risks and exposure to injury or infection. During the early stages of the COVID-19 pandemic, workers in long-term care facilities were said to have the most dangerous jobs in America. And I just want to pull out this quote from Santonia Jackson. She's a 52-year-old certified nursing assistant at CityView Multicare in Illinois. And she is in charge of caring for anywhere from 30 to 60 residents at a time. And she says, as a result, there is not enough time in the day to give them all the care they deserved. Can you believe that? In charge of 30 to 60 residents.
That's insane. There is not enough time in the day. That's one person trying to beat bop around to at least 30, if not double that. Every day that you're showing up to work to make sure people are getting the care that they need and deserve. And this is all due to what? Like understaffing. You're not like giving them the support and, like you said, correcting the ratios, because one person should never have to be dealing with 30 different patients.
On the low end.
On the low end, because people talk about, classroom sizes. Like if a teacher had 30 kids, y'all would be like, oh my goodness, that's so many kids. And it's like, yeah, imagine now 30 different individuals who all require some sort of like medication assistance, some like to just exist and live and be able to like just get up and do minimal things throughout the day. 30 people, 30.
Yeah. And in nursing, there is this push for safe patient ratios, and they were just most is talking about in the hospitals. But if you look at these long-term care facilities, it's even worse. Nobody should be in charge of taking care of 30 individuals. Like people are understaffed, short staffed. This leads to injuries, burnout. Like people are leaving the field. Like COVID-19 exacerbated it, like made people like leave and look for other things that they could be doing. And the people that stayed there, the demands have increased. And the US government is not doing anything about it. Just when they talk about like just simple, like, oh, let's pay people more because people are doing more. And it's just like, so much back and forth, so much red tape that you have to go to just to demand more. It's like, okay, bring in people. And it's like the way to get people in, you have to pay them. And it's like, they don't want to do that. And unfortunately, I won't go into it now, but people are getting older and sicker and living longer, and they're going to need people to do this job. And the system is already strained at this point. Something needs to be done.
It really does, because we are entering now the years of when baby boomers, a huge generation of people, are entering their elder years, and they're getting more and more older. And it's like, we will not have people. First of all, we just don't have the populations of later generations to support them. But on top of that, I think more and more of us younger generations are just like, nah. You need to pay us, and you need to pay us properly. And we're not going to enter into these positions and roles and go to school for something when, like, you're not going to respect us. And it's like, y'all going to be figuring that out, because a lot of people have, fortunately for them, have been able to be like, you know what? No, I'm not going to participate in that. But then it sucks for the people who are in it, who are sort of drowning, going like, I'm trying to take care of all these people. And then, like, there's not a new group of people going like, oh, let me come into this. But if you make it, you incentivize it, and you give good hours, you give good benefits, you give good ratios, you would have more people entering this work. There are plenty of people who would be like, yeah, I'd love to help people. Like, that's just something that a lot of people feel is a part of who they are. And they would happily go into this role if they knew that they wouldn't, like, have the soul sucked out of them in doing it.
That part. That's what I'm saying. Like, I got into nursing because I want to help people. I want to make a difference. And so many people have that. But when you look at it, it's like, I don't want to be burnt out. Like, is the system going to support me as I do this work? And the answer is really no, unfortunately. And, they say, take a rest, but they're constantly, calling you on your days off. Can you come in? Can you come in? And then it's like, you're barely scraping by to make ends meet. It's sad. And the article, it just keeps repeating over and over that Black women are overrepresented in healthcare, and that they are concentrated in the hardest, most dangerous, and most underpaid sectors of the healthcare system. And if you've been listening to this podcast for a while, we always want to ask ourselves, how did we get here? Like, why are we kind of concentrated, at the bottom? Like, why? And in most cases, and in this case, it's by design. We're going to look at some of the patterns. And this research paper points out that these realities are products of the legacy of slavery, when white people forced Black women to work as unpaid domestic servants in their homes. In the research article, they discuss law professor Dorothy Roberts. She also wrote Killing the Black Body. They talk about her racialized ideologies of the division of housework into two distinctive classifications: spiritual and menial housework. The spiritual side was dominated by white women of privilege, and this work was considered to require moral character and relational skills, such as serving as hostess, supervisor of the daily work, or role model for the children. In contrast, the most strenuous and unpleasant tasks, such as scrubbing floors, washing laundry, caring for the bodily needs of household members, and preparing and cleaning up after meals, were thought to require little or no skill. And these menial labor tasks were regulated to slaves and domestic servants, and very closely tied to women who were Black, Indigenous, and people of color. And I think it's crazy that, they think these tasks, cooking, cleaning, scrubbing floors, require little to no skill. But it's just like, imagine doing all these things in whatever time constraints, facing whatever abuse and different things.
Exactly. Like, Because the thing is, I'm just like little to no skill. People literally are just like, don't know how to do their laundry and will mess up their clothes, shrink their clothes, turn them different colors. And you're telling me that doesn't require a skill. But also cooking. How is cooking require no skill? Not everybody can cook. Oh my goodness. That
Right.
is the biggest lie I've ever heard. Little or no skill. Like everybody can just step in front of a stove and make a delicious meal. That is such a lie. Most people can't.
Yeah. And it's just this, just, thinking of, people of color, Black people as, just workers having no skill, no talent. But like, no, this stuff takes a lot of skill, a lot of talent. And it's like we could probably do it all. We can do everything. And the legacy of slavery and the high numbers of Black women amongst domestic servants placed Black women at the center of this culturally constructed division of care. And historical studies have shown important continuities in these gendered and racialized patterns as the economy transformed into the 20th century. Basically, this just continued, like just forcing Black women to these lower ranks of society. The expanding service sector, along with the rise of modern medicine, shifted the nature of care work and moved much of it out of private homes and into institutional settings. Yet, paid care work is still overwhelmingly performed by women. White women are disproportionately represented in jobs with supervisory capacity and also a public relational element and some degree of moral authority, such as registered nurses, teachers, or social workers. Women of color are concentrated in the most physically demanding direct care jobs: nursing aides, licensed practical nurses, or home health aides, along with the backroom jobs of cleaning and food preparation in hospitals, schools, and nursing homes. And the article just goes back to how all this is a structural racism issue. And it clearly lays out how structural barriers make it harder for Black women and women of color. They point out that they can't measure structural racism, but they can highlight the patterns that keep people in certain positions. For example, Black women work overwhelmingly in healthcare jobs that have been constructed as menial or dirty work of care, such as direct care of older, disabled, and ill bodies and bodily function. And Black women face exclusions from medical schools and nursing trainings as these occupations became professionalized, and white women activists carved out the niche of trained nursing by focusing basically on like this moral and spiritual aspects of the job. And these discriminatory and exclusions, they were not outlawed until the 1960s. And even though it was outlawed, these legacies of discrimination and also stereotypes are not easily undone. Just think about that, the 1960s. That's not too long ago. Even though you outlaw something, it takes a lot of time to actually implement it to make this a practice. So that's why we still see the high concentration of Black women in these lower positions, and just looking at this history. And I'm also, every time I'm like, why weren't we taught this? Why am I just finding this out? It's crazy. And, I want to look more into, how Black women were not allowed into the nursing profession and things like that. Like, what was Florence Nightingale saying to Harriet Tubman? you know.
Yeah, and like you said, it like even though something could be outlawed, it takes a while to implement it, and then on top of implementing it, it's in enforcing it, and then on top of that, now you have all the diversity, equity, and inclusion programs just disappearing in a lot of states, just completely, and going like, oh, they're not needed, or people trying to claim that it's reverse racism, or that anyone hired through those practices were, a DEI hire and didn't deserve to be there, when in actuality, they deserve to be there well and above probably a lot of white counterparts who just got there because, I don't know, they showed up and automatically there was a spot for them, while people of color, Black people, Indigenous people had to jump through literal hoops to get there, but yet they somehow don't deserve to be there. And this country and a lot of people who are very racist are rolling that all back because they don't want to see change. So like, if we think it's bad now, like with things that people have pushed through and will continue to try to push through, it'll only get worse because they only see a lot of Black women in this servitude role that like undeserving of any sort of decent pay. It's just like, no, you belong relegated to a kitchen, to some back room. And it's always been so interesting to me though, because like Black women were literally tasked with raising children. Literally tasked like in these positions of making sure that someone is able to finish out their life in some sort of decent manner. Yet that isn't seen as like a valuable member of society, someone that should be highly respected. And like you said, not just, throw on, a hero's t-shirt, pay money for some stupid banner outside of a hospital or a care home and go like, we have heroes that work here. And it's just like, but what are you doing to support those heroes?
Right. How are you treating these heroes? Are you paying them fairly? What are you doing to make sure people are able to advance in the system and things like that? It's just sad. It's just like, it's just like very, eye-opening, very, something needs to be done. Like, it's just like something needs to be done. There needs to be a change because, improving the quality of life for Black women, everybody is going to benefit. Paying them a better living wage, that could lead to more people entering the field, that could lead to better care of your loved one and things like that. So everyone will benefit overall, but people don't see it like that. And I just want to read like another quote from Shantonia Jackson, the nursing aide that we quoted earlier. She said, "People act like since we did it in slavery, we can do it again, and we still don't have to get paid. But it should be about being happy about your job, being proud that you can take care of someone's loved one." Yeah, they're like, just do it. Like,
yeah.
Like, why are you complaining?
Why are you complaining? What else you gonna do? Where else you gonna go? And unfortunately, for a good chunk of people, there is nowhere else. So you're sort of forced in this situation where everybody got a light bill to pay. Everybody got a mortgage, rent, whatever to pay. You got food you got to buy to eat. So you're forced into these positions where you just sort of have to take it. And then you deal with it until maybe you have the opportunity to get out. But like, that shouldn't be it. Like, Shantonia said, it should be about like, you're happy about your job. You're proud that like, I'm taking care of people's loved ones. And, I'm also able to enjoy my life given the paycheck I get from that. Like, you find value in the work and the paycheck shows that you are truly valued for your work. That should go hand in hand for any job, even down to say scrubbing floors, because we all need the floors clean now.
Yep. Each job is important. Each job is needed. We wouldn't be able to do whatever role that we're doing without the people that clean the floors, that take the trash, that prepare the meals, that provide direct care, that are feeding people. Like, every role matters. And this is a complex issue. And what is being done? What is being done to fix this problem, to, make sure that the work environments are safe, that the ratios are safe? And we're going to segue into our second part, and we want to highlight, an organization working to address these big issues. And we want to highlight the Center for Advancing Racial Equity and Job Quality in Long-Term Care.
If you are enjoying this episode, you should consider buying us a coffee. Yes, a coffee. That small gesture will help us continue to create quality episodes and content. Click the Buy Me a Coffee link in the show notes or check out our website at distrustanddisparities.com. After this research article that we discussed earlier was published, it was picked up by the Washington Post. And from there, the Center for Advancing Racial Equity and Job Quality in Long-Term Care partnered with an organization called Heart Research to conduct an in-depth qualitative evaluation of identities, wellness, systematic racism, and how the quality of life could be improved for long-term caregivers. And the Center for Equity, for short, is a national hub for developing innovative workforce policy and fostering narrative change in long-term care. And they center Black, Indigenous, and people of color women and immigrants who are caregivers. And they're working on confronting the links between systemic racial and gender inequalities and poor job quality. And they also unite diverse stakeholders in service of building the equitable caregiving infrastructure that the U.S. needs. And their organizational mission is to promote job quality and equity for the healthcare workforce through, quote, high road training partnerships and workforce development strategies that focus on the intersection of equity, job quality, and educational attainment. In this in-depth evaluation, they state that it is no accident that while long-term care workers in the U.S. provide the essential care that millions of older adults and people with disabilities rely on, the workers themselves continue to be marginalized with little recognition of the crucial role they play in our society. And also, these caregiving jobs are some of the fastest growing occupations in the U.S., yet they are growing without proper attention to the systemic racial inequities that are inextricably tied to poor job quality. So it's like we talked about earlier in the episode, where these jobs are crucial, they're needed, but if you're not going to address the significant issues, and we'll need more and more people to enter these roles, poor job quality, even if people enter these roles, there'll be huge turnover, and millions of people who are reaching older age who need assistance in their lives won't have the quality care that they deserve.
They're looking at the struggles that long-term care workers are facing and trying to unite them, because it's showing that they're struggling to pay their bills. They're not having enough money. And, being able to support and advocate for these workers to get livable wages. They're out here doing the most dangerous work. Many studies have showed that during the pandemic, and even now it's probably worse, that these are considered some of the most dangerous jobs. But how come the compensation does not reflect that? And there needs to be a change. And like you said, a lot of these stereotypes that this is low skill work, but this is dangerous, and I would say skilled work, to take care of 30 to 60 patients and say if they can't do anything for themselves, the whole narrative needs to be changed, and they need to be compensated for this heavy duty, dangerous work that they're doing. And this organization is bringing light and attention to this. And on their board of directors and stakeholders, they have aides and LPNs that are on their board and driving this work. And they took this study that the two authors did, and they brought in the quotes that we were talking about. They come from this organization. They actually interviewed aides and LPNs that are working in these long-term care facilities, getting their perspectives of how they feel basically used and abused, and they're just not being recognized, just being kind of swept under the rug.
And because I think, too, a good quote from this report from the Center for Equity from Deborah Schwartz, who's a senior program manager, quote, "This study commissioned by the Center for Equity underscores that it's time we listen to and invest in Black women if we are to strengthen job quality and confront structural racism in long-term care and build an equitable caregiving system that benefits everyone." And like we've said all along, Black women do some of the hardest work in healthcare, and their pay and working conditions just don't reflect that, because the average hourly pay for many of these caregivers is less than $15 an hour. The Center for Equity really hopes that this study and then their report, that when they were looking at talking directly to LPNs and aides, that it helps in the continued push for healthcare equity in this field. Thanks for listening to this week's episode. Do you have recommendations for topics we should discuss about health disparities or injustices? Guests we should interview doing amazing health justice work? Or organizations we should highlight creating positive change for marginalized communities? Please visit us at distrustanddisparities.com or email us at distrustanddisparities@gmail.com. Remember to subscribe, rate, and review us wherever you listen to podcasts. And follow us on Instagram, Facebook, Twitter, YouTube, and LinkedIn.